Figures collected by the Oral Health Foundation show that nearly 9,000 people in the UK were diagnosed with mouth cancer last year. This is an increase of 34% compared to 10 years ago, and cases have more than doubled within the last generation. To provide some insight on this and tell us what we should be on the lookout for, I'm joined by Dr. Nigel Carter, Chief Executive of the Oral Health Foundation. Dr. Nigel, welcome to the show. Why do you think we've seen such a big increase in cases?
I think really this is down to two factors: a change in lifestyle habits, probably several generations ago. A lot of these cases present in later life, so it's after many years of the risk factors. And the two main risk factors traditionally have been tobacco use, so smoking and also ethnic chewing tobacco, and then also excess alcohol. And the two combined together increase the risk by up to 30 times. But we also now we know that smoking is decreasing, but it'll take some time for that to be reflected in the figures. So we would hope to see them start to come down again. But around 15 years ago, and we've now been running this campaign for the last 22 years, there was an additional factor that was discovered, which was the HPV human papillomavirus, the same virus that causes cervical cancer. Now, this was found to be causing a number of the cancers further back in the mouth, so back of the mouth and into the throat. There's a little bit of good news there because they do have a better outcome following treatment, so not quite so many people are dying as a result. But it's still very important that really we make people aware both of those risk factors, how they can change their lifestyle to avoid those, and also what they should be looking for in their own mouths, the signs and symptoms that might cause us to be suspicious.
You mentioned there that some of the cases are slightly more easily treatable. How serious generally is mouth cancer?
The big problem we have, because people aren't aware of mouth cancer, is that they tend to present very late. And that's really one of the purposes of this campaign that we've been organising, as I say now, over the last 22 years with Denplan, is to really raise awareness of the condition in people's minds, get them becoming mouth aware themselves and checking their own mouths, and when they feel there's an issue, to get along to the dentist. Many present at stage 3 or stage 4, and the survival rates there are honestly not that good. And the treatment is very extensive. So really, if we can push that backwards, and although we're not going to stop the cancers, if we can get them detected at an early stage, the treatment is so much easier and the survival rate is so much better.
Okay, so what should we be looking out for as individuals? How can we check ourselves?
Well, we can check ourselves in the same way that we do for breast cancer or testicular cancer. There's no reason why we can't look in our mouths. In fact, we're doing things with our mouths every day because we clean our teeth. So it's an easy one not to miss, if you like. Have a look round the soft tissues of the mouth, pull the lips down, see if there are any unusual changes there. Have a look at the roof of your mouth, at the cheeks, wiggle your tongue around and have a look if there's anything unusual on your tongue. Now, what are we looking for here? We're looking for the mouth ulcer that doesn't heal over a period of about 3 weeks. In all probability, nothing to worry about, but it's a sign to get along and get it checked out. We're looking for unusual red or white patches in the mouth, particularly if they're changing shape or size or moving. We're looking for any lumps or bumps in the head and neck area, so feel around the head and neck, and also anything like persistent hoarseness that doesn't seem to go away. These are all signs that we should be getting checked out. Get along to your dentist. or if you can't get an appointment with a dentist, and we know how challenging that is at the moment, get along to your GP. The specialist surgeons that deal with these things would much rather see patients early and say you've got nothing to worry about, than to have these advanced cases, which are very difficult to treat, are more likely to give long-term problems and potentially even cause death. So that message of, if in doubt, get checked out, could save a life.
And if we're regularly going to the dentist for, 6 monthly checkups, is this something that the dentists will pick up, or should we be doing checks in between those times?
Ideally, do checks in between the times. Some of these things can progress quite rapidly, and also we're moving towards less frequent checkups because the rate of things like dental decay has reduced. So many people now are only going every 12 or 18 months. So quite a lot can happen during that time. But as part of a routine checkup, the dentist should be checking your soft tissues around your mouth, more particularly if you're a smoker or drinker. But really, at every checkup, we should be checking those soft tissues and checking that there are no problems going on there.
Fantastic. And where can people go to find out more information?
You can go along to the Mouth Cancer Action Month website at mouthcancer.org, or to the foundation main website, which has a lot of information about all sorts of things dental, at dentalhealth.org.
That's great. Dr. Nigel, thank you so much for your time today.
It's been a pleasure, Tim.
That's great. Thank you very much. I hope we covered everything you needed to.
I think we got everything in there.
Good. Excellent. Enjoy the rest of your day.
And you. Bye.
Bye.